we will walk you through how each of those programs work in a little bit of detail. I don't want to take up too much time, so it'll take about 15, 20 minutes for the presentation. Then any questions we may have, we can open it up for questioning at the end. So about 42% of small employers offer group health insurance today. This is back in July of 2011. So 42% of small employers are currently offering group health insurance. And over 50% of those small employers are likely to drop their coverage by the time Obamacare comes into play, which is 2014. And then 100% of those small employers that are likely to drop the health coverage also said they would like to continue offering some type of coverage. This has become a big part of our program, is because a lot of these employers are dropping their major medical plans and coming on to programs like ours, or offering gap types of programs because they're having to raise deductibles, higher employee out-of-pocket costs. So that's kind of where we come into play. You'll see under this, as according to the Associated Press, Walmart stores have drastically changed their benefit package and scaled back coverage for all part-time employees while raising premiums for the full-time workers. So even Walmart, the largest employer in the world, is having to scale back their costs because of the way the rates and increases have been going. This is the projected cost with or without Obamacare. The current cost is about $5,900 a single and $16,000 for a family. And we're projecting about a 9% increase over the next 8 to 10 years. The projected cost in 2015 is going to be a little bit over $7,500 for a single, and then a family of a little bit over $21,000. And then in coming 2020, we're looking at a single coverage of $11,000, a single, and then a family of $32,000. Not many people can afford $32,000 a year to pay for health insurance when the average annual income is, maybe even $50,000. The opportunities for our types of programs, there's over 50 million uninsured people, and is going to grow to over 66 million come 2020. The part-time employment and 1099 status are increasing, especially due to Obamacare. They're lowering the hours of the employees working so they don't have to have that penalty. So a lot of people are going to be coming into the part-time market, and that's where we really specialize and become really popular in the market space. Employers are dropping or decreasing coverage. A lot of employers are dropping their major medical programs and creating a high-level limited benefit medical plan, or including a gap type of program where you put a $5,000 or $10,000 deductible and throw a gap program on there. 50% of the 160 million employer plans are fully insured right now. We're going to continue to see that more groups are going to become self-funded and more self-reliant rather than going into fully insured programs, or actually drop out of the fully insured market completely and just go to the exchanges. As we all know and see, renewals are increasing, and employers are passing costs to employees by increasing deductibles and copays. Who we are. We were formed in 1992. We only had one carrier back in 92, and we've been providing limited benefit medical plans since then. That's really where we started. The president of our company owned the largest direct agency in Chicago, and he saw an eroding market and in his major medical business, and he found this limited medical program, and he created this limited benefit medical plan in 1992, and then he took this really to the streets in about 2000, 2001, and I started in 2002. So ever since then, we've been increasing our sales and then also increasing the carrier programs. Currently, we work with 6 different carriers of limited benefit medical plans, and they're all indemnity-based, where you pick and choose which benefit plans you really want to, they're all customized, so we can pick and choose which benefits we really want to include in the plans and the price points. Usually when, one of the INA reps come to me, they're like, we need a program at about $75 a month or $150 a month. We can create them all in varying levels of coverage. And we usually hit a price point rather than benefit levels, but we can go both ways. What we can do for you, we can become your partner by providing your clients immediate group health insurance with no pre-existing conditions, and it's guaranteed to issue. Most of our programs start at about 5 lives. We do have some carriers that start at 2, but our real niche is 5 and up. We've even got groups of about 85,000 that are currently enrolled in our programs. The advantage of working with us, like I said, we represent 6 different carriers with limited benefit medical plans. We address an employer solution with a, it's like a team we're working with. It's us, INA, and then you guys would be working together, so it's not just you guys out there in the field. We're going to be helping you with enrollment, administrative, and plan designs. We work with some of the top TPAs. We work with Fringe Benefits out of Austin, Texas, and then Cisco, which is out of Dubuque, Iowa. Both have been working in the limited benefit medical field for quite some time. They both have some very large clients with us, and the admin is really where the key is, where your clients are going to stay happy. The ongoing assistance with all of the enrollment administrative issues, we work with Cisco and Fringe would be able to help the employees of your clients calling in with any questions or anything eligibility. While our plans are do not qualify as creditable coverage, they are accepted benefits under healthcare reform, so we'll be able to write our programs throughout 2013 and beyond 2014. So we will continue to see our programs being successful within the future. Our programs are all customized, so we have a I'm just kind of showing you a claims exam. The utilization of our programs. So you'll see most of the people are currently using the diagnostic and the doctor's office visits. That's where we really key in on most of our benefits, is the outpatient services. These programs are really designed to get people to go to the doctor rather than waiting for the last minute when they have some serious issues. So we wanted to go to the doctor right away, and these kinds of programs have been designed to create that. You will also see the average time of first medical claim is after an enrollment is 6 days only, so they are using the programs right away. So our programs don't have a pre-existing condition, so people are able to use it right away. The average number of medical claims per member is about 3.4 claims per year. Most people are on our programs are average only 6 months because our turnover is so high in our in our programs. Average length of a membership, like I said, 8 months. I apologize. I said 6, but it's actually 8 months. An average client's turnover rate is 140%.
And what you're saying there too, Matt, is just to clarify, is we're not talking about that the groups go away that fast. It's just a lot of the industries that we're in. If it's like a restaurant, they turn over their employees have a fairly high turnover in some of these part-time positions. So therefore, the shorter amount of time on your plan. Correct?
Correct. We write a lot of restaurants, nursing homes, and the turnover is pretty high.
And so retail stores. I mean, I know you have big companies like Dick's Sporting Goods and things like that, where it's retail sales with a lot of turnover happens there.
Exactly.
The plans themselves, right? The plans themselves are very stable. I know a lot of times we see a lot of flat to 5% or less renewal rates. These plans tend to stay on the books for a good period of time.
Yeah, for the most part, we're seeing at the high is 5%. For the most part, we've been seeing zeros throughout the last 8-9 years we've been writing the program. So our renewals are pretty flat, and they're not staying with like the major medical increases of like 16-20%. So. Moving along, our programs, like I mentioned, are guaranteed issue with no pre-X. We do have PPO networks available, but they're not required. We call them a passive network. So members can go ahead and get the network providers and get discounted off their EOBs. But if you choose not to and you want your own doctor, they can go ahead to your own doctor, and we'd still pay out the same amount according to the schedule. There's no waiting periods required on the medical plan, so people are starting to use it day one, like we mentioned in the utilization. We have a couple different RX programs. Our standard program, it has no limits on our tiered RX programs. It is a discount program, but we find it very valuable for people that are working part-time hourly. They are going to get substantial discounts off the average wholesale price. But we do have insured RX programs if you do choose to want to increase, the program and for like a group coming off of a major medical type of a program. We have standalone benefits, dental, vision, accident, CI, and disability that we can add to the program through a number of different carriers. So just let us know what you're looking for, and we can always help you out. The discount networks, like I mentioned, that we do have those available. We use First Health, MultiPlan. We use a number of regional ones. Just let us know what you're looking for, and we might be able to access that network for you. We have a program called, it's telemedicine, it's called AmeriDoc, where you can go ahead, instead of actually having to go and see a doctor, you can call them over the phone or even through email. You can let them know your symptoms, and they might be able to prescribe a drug if anything that they think they might need you to send you to an actual physician to let you know, but about 70% of the time they're actually filling a prescription or diagnosing it over the phone. We have a patient advocacy program where anything over $400, a medical claim over $400 is being, we're having patient advocates go out there and help you find doctors and find ways to, help your billing rather than paying out the full cost. There's a technical difficulty. There we go. This is one of our standard limited benefit medical plans. This is higher benefits. I wanted to kind of include our elite type of a program. This one, the employer is paying about 70% of the cost in this one. But I just wanted to show you something that is out there in the marketplace that kind of gives you the full range of benefits. And you'll see is $100 a doctors up to 8 visits per year, diagnostic $300 per visit up to 6 per year, preventative at $300 at 1, emergency room sickness, this is just for illness, it's $200 at 2. The accidental injury care, up to $1,000 per occurrence, up to 3 visits per year. We do have a surgery benefit. It is a schedule, so each member would receive a schedule upon their enrollment, and they would be able to find out, or they can call our enrollment center to find out how much we would actually be able to pay out for a surgery. Some of our programs do have a lump sum benefit. The carrier I'm showing here is Companion Life. They pay the surgery per surgery according to the schedule, though. The hospital indemnity benefit, we pay up to $1,000 depending on the amount chosen, up to 365 days. And we have an admission benefit of $4,000 per admission, up to 2 per year. And then the ground ambulance at $300 per occurrence, up to 2 per person or 6 per family. Like I mentioned, we do have a critical illness program. This is the only benefit that we have that has a pre-existing condition. If you come down with some type of critical illness, that would not be covered at any time during the program. But there's about 3 different categories we work with that you would still be able to fall into. This program has an actual fully insured RX. It's a 10, 40, 75, up to $5,000. Like I mentioned, we can increase the RX benefit if you do choose to. This has the largest network available, MultiPlan, also known as PHCS, available to these employees, so they can access doctors throughout the country. And like I mentioned, this does have the AmeriDoc in the previous slide, where it includes the telemedicine. And these are the weekly costs for the employees. So the actual cost is about $200 a single, but the employer is contributing quite a bit of it. Moving on to our GAP plans, we work with a number of different GAP programs too. I'm sure a lot of you are familiar with these, where you increase the deductible and throw a GAP program or a limited benefit medical program on the front end. And this is an actual case of ours. The current deductible is $1,000, and they paid 80% up to $4,500. So the actual out-of-pocket was $4,500. The renewal program they went forward with was $4,000 deductible at 80%, and the out-of-pocket was $7,500. The monthly savings from just the deductible was $11,000. We threw a GAP program where it was actually covering, if they were admitted to the hospital, 100%. So they were paying $8,000 for the GAP, and they would, that would cover 100%. And then if there was an outpatient service, we would still have $3,500 out of pocket, but it's still much less than what your current medical plan was. The monthly cost of the GAP plan was $6,500, which saved the employer $5,162, and it was $60,000 annually. So these types of programs are becoming more and more popular. We have a number of different carriers out there that we're working with: Transamerica, Companion Life, and Fidelity Security. All these programs have different outpatient benefits, which is really the key to them. I really like the Fidelity Security outpatient benefit because it includes benefit for lab work, x-rays, diagnostic tests, chiropractic, There's a number of outpatient services that usually aren't included in a lot of the other carriers out there. So I really like that benefit. That kind of just gives you an overview of the gap plans. I'm sure a lot of you are familiar with them. I kind of wanted to just show you a couple testimonials. We currently work with Denny's restaurants. We've had Denny's for about 7-8 years right now. This is just a testimonial from their benefits manager, Dory Hummel. And then we also work with Nationwide. We're Nationwide's largest producer. From the Tom Denoma, the Associate Vice President over at Nationwide, wanted to endorse us as well. These are some of our clients. You'll see Brinker International. Brinker International is our largest client. There's about 85,000 eligible in the program for the program, and we have about 10,000 people currently enrolled in the program. One of our other large clients is Dick's Sporting Goods. As Mike mentioned before, we do a lot of the retail, restaurants, grocery store chains, a lot of nursing homes. So if you have any questions about any of our any groups that you may want to look at offering a limited benefit medical plan or a gap type of program, please contact your INA rep, and we'd be more than happy to assist you. I'm going to open this up for questions, Mike. So if you want to go ahead and open it up, and we can go ahead and start with there.
All right, well, a couple of questions. Someone's still asking here about what size of groups you write. I think you said pretty much 5 and up is kind of our size arena, correct?
Yeah, 5 and up. We can write groups of 2 and up, but most of our carriers start at 5 and up, and we can go all the way up to, like I said, 80,000 is our largest client. So.
And then can you refresh us again on what networks you work with?
Oh, yeah, we work with Multiplan, or also known as PHCS. We also work with First Health, and then we also have a lot of regional networks. If you have any questions about any other networks, we might be able to even offer those, so just let us know.
Kim here is asking, how are they filed, the plans filed? I'm not exactly sure how to answer that. Can you answer that for us?
Well, they're indemnity-based, so they're filed as an indemnity program or a supplemental type of a program. That's why we're considered an accepted benefit.
Okay.
When you're an accepted benefit, since we're offered as a supplemental program, we're able to write it past 2014. Some of our other competitors out there in the marketplace, I'm sure a lot of people have read about McDonald's. That's where all the fuss came up about offering these waivers for some of these other programs like the SRC and Cigna programs. A lot of them got waivers, but as come 2014, they're gone. So there's going to be a lot of large cases out there, or even small cases out there in the marketplace that will be looking for limited benefit medical plans.
Now, how are the mini-meds, like the StarBridge products, how are those plans going to be affected by healthcare reform?
Yeah, those are going away because those do not have pre-existing. They do have pre-existing conditions. They have low annual limits. They got waivers up until 2014, but once 2014 comes around, then those programs are going away.
Okay. I see another question here. What about associations? Then they ask specifically about truck drivers. I know personally, as far as truck drivers, I've written, in my days when I sat behind the counter making the phone calls, I've written quite a few truck driver companies just because their rates were really high. And I actually designed some plans that were, this particular company asked for a plan that was very expensive. We were around $450 an employee, but that was half of what they were currently paying. The benefits were amazing. So I can tell you truck drivers are not a problem. Maybe you can answer, how would you handle associations there, Matt?
Well, like Mike said, we can write 1099 drivers, 1099 drivers, truck drivers, whatever. We can write those all day long. So we have actually seen an exploding market because a lot of people are becoming 1099ers. In regards to the association market, associations are a little bit more difficult. We have a portfolio or a platform where you can go ahead and offer individual benefits. Associations, we would need, a lot of the amendments and things like that to go ahead and get it filed, but we can do them. Just let us know, and we can maybe find a home for
them. Kim's on a roll here. She asks, what carriers, Transamerica and who else? I know you do Nationwide, Security.
We work with Nationwide. Nationwide is our largest carrier. Everybody knows Nationwide on our side. Companion Life, which is Blue Cross and Blue Shield of South Carolina. Standard Security Life. Pan American we've worked with, Transamerica, American General. So we've got a number of different carriers we're currently working with. Each of them has different requirements. So for example, Companion Life can write 5 lives and up. Nationwide has 10 lives and up. So we find the right fit for each group. Most of our large cases have been very successful with our Nationwide program. So once you come up with an opportunity, we'll talk about each of the cases individually, and then we'll be able to figure out the right place and the right fit for them.
I have another question here. Do you do defined benefits that allows before tax dollars to be used?
If I'm answering this correctly, I'm not sure. Our programs are considered, or you can file them as a Section 125, so you can use pre-tax dollars
To pay the premiums.
Right.
Right, exactly. So hopefully that answers, Wilma, hopefully that answers your question. If not, be sure and give your INA rep a call or give me a call and expand on that, and we'll get you a better answer if you need more than that. But I do know these can be, the premiums paid for the plan can be taken out pre-tax. All right, I think that about does it for questions. I want to thank Matt today for jumping on. I'm going to take the reins back away from Matt here.
No, we appreciate your time. Thanks, for joining our webinar, and let your INA rep know if you have any questions, and we look forward to working with y'all.
Great. We just like to also let all of you know that we recently just had our summit, our annual summit, where we have agents from all over the United States come in for 2.5 days for training, education, and for get you fired up about how to run your business more effectively, make more money. At the same time, we announced at that seminar that we would be doing a special program for our Costa Rica Top Producers event, which is next year. And what we've decided to do is we are going to offer double bonus points for any business written through INA between now and the end of the year with one effective date, and then it approves by January the 10th. Limited benefit plans also count. Those is another product that we like to use, and we like to write a lot of it. You can actually qualify to go to Costa Rica with as little as 75 lives, and you would get 5 days at this resort here, all-inclusive, meaning meals, all your alcohol. Most of the entertainment on-site is covered as well. So for 75 lives between now and the end of the year, just limited medical alone would get you in. But all products count. If you write annuities with INA, if you do dental, if you do major medical, individual medical, all of it counts. We're doubling the points. So just wanted to encourage you to give us a chance at your business, or if you have an opportunity that you're not sure about, call your rep and see what you can do about, see if we can help you out. So thank you for attending. And if you have any questions at all, be sure and give us a call at 800-4567-999. So thank you again. Matt, thank you.
Thank you.
You bet. Make it a great day. Oh, by the way, this will be recorded, and it will be on our INA website within, I'd say 24 hours for those of you who would like to see it again. All right. Make it a great day.